But first, having weight loss surgery on the NHS can see patients sitting on waiting lists for years. Many look abroad for quicker solutions, but as we've seen in this series before, health tourism is fraught with risks, as the woman in the next film found out when her surgery in Turkey went horribly wrong.
I can't eat, I can't drink, and it's looking like that's going to be permanent. I may never eat or drink again.
Pinky Jolley from the Wirral is now living with the aftermath of having gastric sleeve surgery.
I've always been overweight. Several years ago, I was diagnosed with fibromyalgia. My mobility was very limited. Paul, my husband, is my full-time carer.
Pinky's weight was adding to her poor health and was affecting her so badly that she was advised she should have gastric sleeve surgery. This involves removing 80% of the stomach, massively limiting the amount one can eat or drink.
In the procedure, what the surgeon does is basically reshapes the stomach into a much smaller tube. So, for example, about the size of a banana. And that then creates a few changes which then leads to patients losing weight, roughly about a third of their body weight.
After sitting on the NHS waiting list for 4 years, Pinky decided to look into having the surgery done privately.
The cost was approximately $10,000, and I knew straight away I could not afford that.
With private surgery in the UK out of the question, Pinky looked further afield.
I'd mentioned that I was looking to go abroad. Lots of people contacted me to say that they'd been successful. And also, once I'd put that out on the internet, adverts started popping up of loads of different clinics.
Pinky decided to have her operation at a clinic in Turkey. The total cost of her treatment and accommodation would be £2,100.
$2,100 is a vast difference.
In November 2022, Pinky and her husband Paul flew to Istanbul in Turkey.
I was really excited. I was finally going to do something about my weight.
The following morning, Pinky had her surgery, and on coming to, she immediately felt that something was badly wrong.
I was in excruciating pain, like nothing I've ever felt before. They're supposed to have done a leak test.
A leak test is when a dye solution is fed into the stomach so that surgeons can detect if there was a problem with the surgery.
They told me to keep walking. I'm a wheelchair user. Obviously, I kept pointing at my wheelchair. 2 days after the surgery, I was discharged to the hotel.
Pinky's aftercare should really have been set up to recognize early complications. So as soon as Pinky alerted her surgeon or her physician that something wasn't right, she should have been called back to the hospital, and then a full set of assessments and investigations should have been done.
2 days after being in the hotel, we flew home. My aftercare was all via WhatsApp. If I got a response, it was always, "This is normal. Carry on walking, carry on drinking."
Now back in the UK, Pinky's pain continued.
Made the doctor's appointment. I asked him if I could have a blood test. The doctor rang me the moment he got the results, and he said, "Get to hospital now." The doctors explained to me I had a leak in the staple site, that my stomach had twisted and it was causing a stricture. There was also a big pocket of infection.
When it happens, it needs to be taken care of quickly, because if you take care of a leak quickly, it's fully recoverable. If you leave a leak untreated, that's when patients can get really sick and seriously sick.
Because Pinky wasn't diagnosed until sometime after her return to the UK, she suffered irreversible damage, and now she has to be fed through a tube.
I was fitted with an NJ tube that goes from my nose down to my upper bowel. I'm fed a formula that sits in a pump, and all my meds go down there. I have lost a significant amount of weight since December. It's approximately 10 stone, but it's certainly not in a good way. Completely malnourished.
Pinky wanted to hold the clinic accountable for what happened.
Ultimately, I requested a video consultation with the surgeon, but that didn't happen. So I shared my views and experiences on social media.
Which did not go down well with the surgical team in Turkey.
Their final message was to tell me that they were going to communicate with me no longer because I painted the clinic and Turkey in a bad light. I was angered by their response. I told them I was quite within my rights to say what I've said.
This experience has left Pinky in no doubt.
If I could wave a magic wand, I would have had the surgery with the NHS. They're reliable, trustworthy, and they're accountable. I've been left with irreparable damage. This is going to be a lifelong problem I have.
It's a shocking outcome for Pinky. Well, we tried to contact both the clinic and the surgeon that operated on Pinky in Turkey to get a comment, but we hit a brick wall. So joining me is Mr. Ahmed from Imperial College Healthcare NHS Trust, and he's one of the leading bariatric surgeons in the UK. He's a consultant in upper gastrointestinal surgery. Mr. Ahmed, thank you very much for joining us. We just saw you in that film with Pinky. She's by no means an isolated case. You look after people who've had these problems. What kind of things are you seeing?
Yes, so we tend to see two different scenarios. We have patients who are so ill when they come back from abroad after their surgery that they literally either get sent in an ambulance to our hospital or they come on the train straight from the airport into our casualties really sick, and then they need emergency surgery and intensive care.
You literally mean land at Heathrow, get on the tube, get off at Paddington and go straight to St Mary's to
Sadly,
be seen by
yes.
you? Wow.
Sadly, yes.
And what's the other group of people that you see?
The other group of patients are patients who've had surgery abroad, but they just failed to recover completely from surgery. For example, they have continued vomiting or abdominal pain or discomfort, and then they go to see their GPs, and then their GPs refer them to us to see what's going on.
So lots of people do seek healthcare abroad and they don't have these kind of complications. But when we see them, they're really awful. Why do we see them?
We see them firstly because patients feel that they need to go abroad for surgery, and that's the first problem. Why do they have to go abroad? And the reason is simple. Unfortunately, our waiting lists are long in the NHS, especially for weight loss surgery. People often end up waiting 2 to 3 years, and that's really unfair, but we don't have a solution for it at the moment.
So people are in this terrible position, and we definitely, of course, should be, I'm kind of cheering for people who want to take charge of their health, who want to do something to improve their health. But when you cut the bill from £10,000 to £2,000, there are going to be some shortcuts. How are they achieving those savings?
From what I've seen, surgical instruments which should only be used once sometimes get re-sterilized and get used more than once repeatedly. In some other cases, I've found patients are told they're going to have one surgery and actually end up having a much simpler or cheaper surgery.
So clearly there are lots of people who seek healthcare abroad and they get a great result and they get good value for money. But there is this danger, isn't there, that if you are going, for example, to a clinic in Turkey, they're not necessarily incentivized in the same way. And if they want to take shortcuts, it's going to be harder to hold them to account.
Absolutely.
There will be people who are just in this terribly difficult situation. They're desperate for the surgery. The NHS waiting list is too long. They really can't afford private care in the UK, and they are looking abroad. How would you go about choosing a clinic abroad to make it as safe as possible?
It's really difficult, but my suggestion would be speak to other people who have been abroad, have a chat with them, see what their experience has been with the clinic they've been to, their experience has been with the surgeon who treated them, and then maybe make a decision.
Mr. Ahmed, thank you very much for coming in.
Thank you.